like nowadays. So, have there been any changes?
That's a good question as well. This is the open enrollment period as well for Medicare. Those are for individuals who are over the age of 65 or for individuals who are disabled. With the Medicare open enrollment, the main advantage to that is if you are on what some consider a Medicare Advantage plan or a Medicare Part C, this is your time to make sure that's the appropriate plan for you for the upcoming year 2019. Now, that open enrollment does end on December 7th, so we're a little more pressed for time for that one. But if you do have Medicare and you'd like to look at some other options or alternatives, this is the time to give us a call as well, just to make sure you're in the appropriate plan.
Number again?
414 716 6274.
Now, is dental insurance offered by the ACA?
Dental insurance, we do offer it through our agency, but usually it's just for health insurance on the marketplace. And health insurance, which I'm sure, just to clarify, is going to cover your doctor visits, hospitalization, prescription drugs, and preventative care, things of that nature. So if you're looking for dental insurance, it's something that we do offer through my agency, but you usually won't find the benefit on the marketplace.
Now, how much are the plans?
The rates, the plans vary. There are several factors that determine someone's rate. Some of the factors that determine the rate, of course, are age, gender, tobacco usage, even the county you reside in. So there are some factors that do come into the rate, but the rates are varied.
I tell you, you keep on living and just don't die. You're going to need these great services. Now, but how do I choose which plan is good for me? I don't know.
Yeah, that's where an agent comes in. That's where I come in. That's sort of my job. Usually, as I just mentioned, there are several options out there. When you put these factors into the website, sometimes you get about 10 or 15 different options to choose from. Some things that I tell some of my clients to do when they're deciding on a plan is to always have a list of your providers. Most of these plans, that's the main difference with the plans on the marketplace, is the provider network. Provider network, when I say that, I mean the network of doctors that you can choose from when you're seeing your physicians on these plans. So the main thing I tell my clients is to make sure that they do have a list of their providers available, so we can check their providers and make sure that their providers will accept the insurance that we offer to them, or we recommend for them to choose. So the main thing I would say is to have your provider network handy when you do want to look into a plan. Then we'll put those different factors in and determine what the rates would be.
Now, Ms. Bacchus, I'll tell you what. Now, some of us may think doing all of this stuff with all this paperwork is going to be difficult. Is it?
Probably if you do it alone, it could be difficult. Like, it could be difficult if you just want to sit there and tackle it alone, but